Hi guys, how are you? It's Aaron Intende, and today, before going to my duty, before going to my shift, I wanna tell you something. Before leaving to work, I wanna tell you something. So, guys, I wanna tell you something. What's the difference between a home health aide and CNA? Remember, when you come to USA, there is two kinds of caregivers I want to talk to you about: CNA and home health aide. Why do I categorize a CNA as a caregiver? It's because while you're working, when you're CNA, they can say, "Aide, please come and I need your help." Aide. When they say aide, it means they need care. So CNA is a caregiver. It's giving care to the patients, to the clients. Come close. So let me put on my shoes. But before putting on my shoes, let me tell you guys what's the difference between a caregiver, a home health aide caregiver, and a CNA. Let me tell you guys one thing. Let me tell you who is a CNA. First of all, CNA is certified nurse assistant. Means without the nurse, a CNA cannot be. So a CNA has to work alongside nurses. There's one nurse called LPN who gives meds, and there's one nurse, overall nurse, and there is a doctor. So a CNA works under governance of medical staff. Yes, you guess right. So what does HHA do? HHA is home health aid. So home health aid, what does this person do? Is a caregiver too. It takes care of patients from their private homes. Also, you can find, like, from the private home, he can also go to rehabilitation centers accompanying his patient. But remember, also CNA can also go to private homes. He can be a private CNA, and he can work as a home health aide. So without you getting confused, let me take you right into a CNA. What is a CNA, and how is a CNA different from a home health aide? It's easy to become a home health aide because you need a certificate of a home health aide. And it's not easy to become a CNA. A CNA is a certified nurse assistant. Sometimes they call nurse, they call him nursing aide. Uh, so let's go deep. How do you become a CNA? I know this is most interesting for you guys. How do you become a CNA in America, in the state of Massachusetts? So I believe it's similar to other states in USA. So a CNA, a nurse, a certified nurse assistant. Do you know why they put that word certified? It means it goes and is certified by the state or by the government. So how does a CNA get certified? And why HHA is not a certified nurse assistant? Let me tell you one thing here in Massachusetts. In order to become a CNA, you have to become a home health aide first. Then if you do the test of state and you pass it, you become a CNA. You get a certificate which has codes of your license. So this video is gonna be long, but I believe most of you are interested in it. So let's read. This is Gogo. A CNA call him or her nursing aid, provides healthcare and support to patients in a medical facility. Their main duty includes offering basic physical assistance to patients, feeding patients according to their dietary and according to their dietary needs, and recording vital signs. We are going deep into the roles of a CNA. I know somebody was asking me on TikTok and YouTube about this. Hope you're gonna get clear information from this. This is coming from Google. So, what are the roles of a CNA? Before taking you into the roles of a CNA, which I got from Google, this is what you have to know. A CNA works in facilities like hospital, facilities like nursing home, rehabilitation center, assisted living, and private homes. Those are kinds of facilities where a CNA works. Let me repeat for you. A hospital, nursing homes, rehabilitation centers or rehabs, nursing assisted living, then private homes. Now I will take you to the roles very fast. They are known as the role of CNA is taking vital signs, answering patients' calls, assist patients with mobility, helping patients with eating and drinking, maintain the sanitation of patients' area, proper transfer of patients, monitoring patients' health, repositioning patients in bed, bathing, dressing, feeding, dressing patients, facilitating patients' care, feeding, setting up medical equipment like preparing medical equipment in case of any. So guys, setting up medical equipment is one of the work of a CNA in case of operation, in case of anything. A doctor needs help, you go and help. If a doctor is working onto a patient, then assisting medical procedures in case there is a medical procedure they want to do with a patient, you go and help. Changing linen is the bed sheets. Changing, you take off the dirty ones and you arrange the bed properly. Then we go further. Cleaning the room. A CNA is not a housekeeper, but he has to make sure the room is clean. For example, there is spill on the floor. You can clean it and trash. Or you can arrange the room to make it neat and clean, because visitors are always coming in. So you have to keep it clean. You have to call the housekeeping in case of you need bathroom washed, refreshed, like that. So that's all a CNA duty. Dressing the patient, like in the morning, you're dressing the patient. That is your duty as a CNA. Also, undressing in case there is something went onto the dress and the patient wants to change, you change the patient. More roles of a CNA: measuring and recording patients' food and liquid intake, performing basic movement exercises, stocking supplies like the patient needs a corrugate, needs a toothbrush, needs warm water, needs something to drink, supplies like as I've told you, the patient needs a nightgown. The patient needs soap. You have to go and bring the soap from the storage room because this is your place of care. Then we go to caring for the wound. Some CNAs, they will teach them how you care for the wound. So you might need to care for the wound, like dress it up, clean it, change it, and again dress up in a fresh dressing. Then CNAs are indispensable lifting and moving patients, like patients who cannot move, who are bedridden. You move them, like they want you to change a patient from one room to another. To relocate them, you can relocate the patients. And some patients need particular machines, machines like Hoyer lift and other kinds of machines. You need to use those machines as a CNA because you're trained to use those machines, so you can use them and lift the patient from the bed, put them in the wheelchair, and transfer them. Then we go to the last one is hydration and nutrition. This one is like you need to make sure the patient takes drinks, like you need to offer drinks, offer juice. If he asks what she has, you can bring. If they don't ask, you have to know that let me try to offer this patient because they need him or her to drink. So, guys, that is one. Those are the roles of our CNA. If I've left some, you can comment. So, something I want you guys to understand is a CNA. A CNA sometimes is called a nursing aid. Sometimes it's called assist. Sometimes it's called so a CNA is certified by the state, but a HHA is not certified by the state. What does the word certified mean? It means you did a state exam and passed it. To become a CNA, as I told you, you have to first become an HHA because you all go through the same process. Then if you want to continue and become certified, you have to go through a state exam. There is, first of all, there is knowledge test, then there is practicals. You might pass knowledge and fail practicals. So if you fail each of the two, you might not pass, but they give you chances to redo. But until those chances are done, maybe they will give you 4 chances or 3 chances. If you don't, then you have to wait another year or 2 years to redo those tests because they need you to go and study to be certified. So a CNA works in facilities like hospital, nursing homes, rehabilitation centers or rehabilitations or rehabs, assisted living, then private homes. Private homes, those are people's homes. Like you have your grandmother, you need a CNA to take care of him or her. Remember, when you become old here, you cannot take care of yourself. So you need somebody to help you with dressing up, go to the toilet, clean you, take shower, someone you can talk to. You need company. They cannot just dump you in a big home without anyone to care for you. So they have to hire CNAs to take care of you or HHA, home health aid. So a home health aid will only work in facilities like uh, assisted living and private homes, whereas the CNA works in hospital, nursing homes, rehabilitation, assisted living, and private homes. So, guys, who is a home health aide? A home health aide cannot work in a nursing home or hospital where CNAs can. but can work in assisted living and private homes where CNAs can work. So let's go on. What are the primary role? The primary role are, now this is the primary role, then we go to the key roles of home health aid, that is the HHA, that is the caregiver, you guys know. So in Uganda they say abakola mu bakadde, those who work with the judges, the elderly, those who work with the elderly in America. So this is the primary role before going to the key role. The primary role is to assist clients with their daily living activities, including bathing, dressing, eating, light housework, while following instructions from the healthcare professional. Essentially, providing non-medical support to help their individuals maintain their independence at home. So the primary role is you help with bathing, like in the morning, uh, eating, to feed them, preparing their food, their meals, dressing them up, lighthouse, housework like cleaning around, making the place look nice, like where he or she has eaten, you clean it, you go and run the dishes too. Some other work you can find is you have to make the laundry. So let's go to the key roles where we shall see more of the responsibilities of this uh, home health care provider, home health aid, HHA. Now let's listen, guys. Key responsibilities: personal care, helping with bathing, dressing, grooming, toileting, and mobility. Meaning you have to help them to move around, like they want to go toilet, you help them. They want to make their, you help them even with the process. You have to even help to clean them when they're going to the toilet and clean them. You have even to monitor them so they don't fall. If they fall, it will be your fault because you are not there to support them. Remember, they are elderly, so they need that kind of support. Sometimes here they are talking about companionship, so you have to be there to give them companionship in case they need support, like they have going through a situation, maybe they are lonely, they're thinking about their lost or dead person, somebody died, they are there, they need your companionship. Or even they're bored at home, you have to be there and give them uh, uh, provide conversation, social interaction, like talk, motivate them like you're motivating someone from your home. Motivate them. That's why you're there. You're not there to do any other thing, but you have to motivate them, give them companionship. Then helping them to take medication, but it has to be uh, prescribed by as prescribed by the medical persons. You're not there to prescribe something, but you are there to help them, like give them water, remind them. Then we go to other tasks like taking vital signs. You can take temperature, you can take temperature and blood pressure. That is your role as a home health aide. They might tell you to monitor the pressure and temperature of your client. So the other role is uh, while they may be performing some basic healthcare tasks, that is you who is HHA. They say, first of all, HHA is not a medical professional. While they may be performing some of the healthcare basic, they are not licensed nurses and cannot administer medication or perform complex medical procedures without proper authorization, without without proper supervision by a healthcare team. Home health care, home health aid work under direction of a registered nurse or other healthcare professionals who develop care plans. Guys, hope you have understood something from this. For me, what I've seen is CNA is more of medical, whereas home health aid is more of a caregiver, like her home, like is taking care of a mother. What you can help those elderly, like you can help them to run errands. You can take them, you can go and buy groceries for them. If you leave somebody at home, you can buy groceries. You can even go with them to buy groceries. You can give them companionship. You can help them to dress up. You can help them do their laundry, help them when they are eating, even preparing their meals. So you are there to help them. You are like a maid, but for you, you're a professional home health care or a home health aid. You're not a maid, but you are there to care for that person as under the instructions of the medical team who have made the care plan. So guys, I will end up my video from here, but if I've forgotten something, please remind me in the comment, and please share my video. I know this video is for you who is coming to USA or other countries where they all do the same thing, like CNA and home health aid, who is the caregiver. Most of you understand. So guys, thank you for following. But one thing I will tell you, if you're outside USA, the license which you have, most cases you have to redo. When you reach here, you have to redo, unless it's something which doesn't need complex like license. But most of your certificates and like CNA certificates, you have to redo when you reach USA. Thank you guys for watching. Bye bye.